that really implies that we need to give all people agency in issues that affect their environment and their health. And then at the end of the definition, it reinforces that with implementation and enforcement of environmental laws, regulations, and policies. So, and then for those of you who may not be as familiar with public health, the definition of public health is a science of protecting and improving the health of people and their communities. So what I will be talking about for the rest of the session, and one of my main foci of research, is how do environmental justice issues affect public health and the health of communities as well as individuals. So in this first part, I'm going to show you a lot of evidence to convince you that environmental justice is a major public health problem. So first off, I like to start with this statistic in a lot of my presentations. This is coming from the World Health Organization's most recent report on the environmental burden of disease, where they have estimated that 24% of all mortality in the globe is attributable to environmental causes. And what's interesting here to point out is the section where they refer to these as modifiable environmental causes particularly, which means all of these deaths could have been prevented if we had addressed these environmental conditions. In my opinion, this estimate is probably, if anything, an underestimate rather than an overestimate, based on the fact that when you look at the fine print of how the World Health Organization put this report together, they really focused on only a few key environmental hazards for which we have substantial scientific research and literature to back it up. And there are beyond that a large number of environmental hazards that weren't incorporated into this percentage. So, so my professional estimate is that the 24% is, if anything, an underestimate of how much mortality, and you can extrapolate it to morbidity and other health issues, of how much of those are actually related to environmental issues. And then moving on with data to more directly document that environmental justice is a public health concern as well. The first is race is the #1 predictor of the placement of toxic facilities in the US. And this is based on work from, some work from my lab and my students, but also from work that has been published in the literature in different areas. And this has been seen over and over in research that's done in different states and different areas of the country, that the best predictor of where you're going to have a toxic facility or a waste dump or anything like that, the proportion of individuals in that area who are of minorities is the best predictor of where those facilities end up going. And so there are also some indicators of environmental injustice, is how I like to attribute it even more, in that we have very disparate rates of a lot of health conditions that can be linked with environmental causes. Childhood lead poisoning is one of the most obvious. You can see by the slide here, and this is data that I got from the American Public Health Association. African Americans have childhood lead poisoning rate of 11%, whereas Mexican Americans at 4% and white Caucasians only at 2.4%. So there's a huge difference in the rate of lead poisoning based on one's race, ethnicity. Also, more data from the American Public Health Association. They have looked at a lot of publicly available data and summarized it as African Americans have a 54% higher health burden from air pollution. And this is based on a lot of really high quality monitoring data of what parts of the country suffer from more air pollution than others. And then that linked with what we know about the effects of air pollution on health. And the parts of the country that have the most air pollution also tend to have higher relative populations of African Americans and other minorities. So, so it's really clear from these data and other data like it that the burdens of environmental hazards fall disproportionately on minority as well as low-income communities. Right, and that's the reference for the data. And there's some more data to show on a national level. These are data from the Kaiser Family Foundation, where it's looking at different racial ethnic groups and various health status or outcome measures, and seeing how many different kinds of health outcomes like cardiovascular disease or neurological disease or kidney disease, right? So the combination of all of these among the different racial ethnic groups, which groups fare better, worse, or the same. And I don't know if you can see my pointer, but the key factor I want to point out is if you look right in the middle with the black column, the column of Black or African Americans, the column of Hispanic Americans and American Indian and Alaskan Natives, they all have a much higher burden of, in many cases, chronic disease conditions than other groups, especially compared to white Americans. And I believe that a substantial part of this is in part due to that unequal burden of environmental hazards that are present in communities where these individuals live. So I wanted to take this a little bit closer to Indiana for a little bit and talk about disparities that we know that exist within Indiana. And this is data that was published by a group from Indianapolis. And what they're doing here is looking at different communities around Indianapolis and demonstrating the average life expectancy. And so this has been done here in Indianapolis. Similar studies have been done kind of across the country with major metropolitan areas. And very consistently, you can see that parts of Indianapolis, or any major city really, that are low income, high minority, have substantially lower life expectancy than areas of the city that are higher income with less minority population. And with this particular slide from Indianapolis, you can see that right close to downtown Indianapolis, life expectancy is around 71 or 70 years. But if you get up into the northern suburbs, the life expectancy expands dramatically. So that reflects a lot of different things. But one of the things it reflects is where you live has an impact on what your expected life span will be. And part of that is related to environmental injustice that we still see throughout the United States. So how did we get to a big state of environmental justice? In the early days of the environmental justice movement, there was a lot of debate about why did environmental injustices happen? But I think this is really summarized pretty well from a seminal paper by Bullard and Wright, where they say that the state is less likely to meet resistance in a community of low income, blue collar workers with a high school education or less, and that all socioeconomic groupings, like basically all people, resent the presence of facilities that would cause environmental hazards near where they live, but middle and upper socioeconomic strata have better resources to oppose them. So a lot of the environmental injustice happens because the low-income blue-collar workers or minority communities don't have as much political agency, is a good way to put it, to protest siting of hazardous facilities or industries in their area. And that over time, this accumulates into a higher level of pollution in areas where less advantaged communities tend to live, right? And so this is just basically a cartoon which expresses the same idea. And I promised a brief history of environmental justice issues. This is a photo from Warren County, North Carolina, which was one of the first areas where there was protesting of environmental injustice actions. In this case, the community was protesting siting of a landfill with PCBs in their neighborhood. Right, so then a lot of the early movements of environmental justice did happen in the 1980s, which is not as long ago as you might think. So environmental justice is still a relatively new field with a lot of information that we still need to work on and get better understanding of. So like I said, the protest against the landfill was one of the first movements. The Toxic Waste and Race in the United States, which was published by the United Church of Christ, is one of the seminal works that first documented the existence of environmental justice issues across the US. And then Robert Bullard, who was a co-author on the paper I showed you the quotes from before, he's considered the father of environmental justice because he did a lot of this early work in this area. His book called Dumping in Dixie, which is about placement of landfills and hazardous waste sites in the South, is considered also one of the key primary works which really drove the development of the environmental justice movement overall. And then, so a little bit more of the history. Following all of the initial issues that were raised in the 1980s, the federal government did start taking action on this in the 1990s. The Emergency Planning and Right to Know Act, which is better known as the Superfund legislation, actually has some portions of it that are relevant to environmental justice and particularly access of knowledge. So the Superfund Act and the RCRA, the acts that came along with it, had segments which enabled better access of information about what environmental contaminants were being released in which communities to community members. So kind of as a result of this, you can still go on the EPA website even today and look up which communities are polluting in your local environment. And so that's the end result of some of these early legislative acts here. However, the vast majority of federal regulations or guidance on environmental justice is through executive order or internal programs. So within the Environmental Protection Agency, they formed an Office of Environmental Justice in 1992. And in 1994, there was an executive order from Bill Clinton, and this is really the key document on a federal level that addresses environmental justice. And so all this executive order does is state that environmental justice must be considered in actions taken by the federal government. So again, because it's an executive order, it only affects federal agencies, but it is at least something to promote consideration of environmental justice throughout the region. Since then, there have been additional programs and especially research opportunities in environmental justice. And I've been pleased to note that in the past couple of years, these have been expanding very dramatically. And I had the pleasure to communicate with EPA Region 5 Office of Environmental Justice just recently, thanks to coordination from the Center for the Environment. And I was pleased to learn that they're actually being very proactive in their actions lately. So hopefully there may be some additional actions to promote a fair environment for everyone within our region in the coming years. Yep, sorry, I went backwards. So this is something else that I wanted to briefly share with you. This is something I found from a very good research program that has information you can access, but this is really emphasizing the fact that environmental justice or environmental injustice issues have become really rooted in our society. So they're part of the systemic racism that we've been talking about for so long, in that once you have an issue with environmental justice in a community, it can compound, and it's easier and easier for additional hazards or risks to be developed in that community. So it's really a cycle of once a community is impacted, that community continues to get impacted over time. So one of the things we need to think about is how can we break this cycle listed here of environmental health disparities or environmental injustices. And then I wanted to share with you some examples of where we can find environmental injustice issues within Indiana as a whole. So these are data I'm showing you that are from the Centers for Disease Control and Prevention. They have a environmental health tracking website, and they have this data and some more detailed data available for those of you who might be interested in it. And so here, there's a series of maps I'm going to show you to demonstrate what parts of Indiana suffer from more environmental hazards, and at the same time, which parts of Indiana suffer from more health issues and social access and the ability to advocate for their own communities as well. So, and you'll see that there are specific pockets of Indiana where you can see that the environmental justices, the health conditions, and the lack of social agency all tend to converge on the same spots. So here, this is annual average particulate matter 2.5 concentration. So this is an average of fine particle pollution that's in the air. So very small soot particles in the air. And we have a big concentration around Indianapolis and also a little bit more towards the north of the state. You can see days with ozone exceedances. So ozone is another hazardous air pollutant, and you see the combination of this looks fairly similar in terms of the areas of Indiana that are really affected by it. And this is the vulnerability index ranking. So this was put together by the CDC, and it's a combination of things like the percentage of the population in poverty and the percentage of population with access to various resources and that sort of thing. So you can see that there are pockets of individuals with higher vulnerability, in this case, potentially to environmental hazards. And the areas I was talking about before, you can see that it's not really Indianapolis as a whole that is suffering from this, but the center part of Indianapolis that I already showed you has a lower life expectancy that also ranks high on potentially being vulnerable to having additional hazards or threats coming their way. And also I mentioned Northwest Indiana, and you can see that the area right in the north of Lake County also has a similar high vulnerability index ranking. And then looking at specific health outcomes, this looks like it's almost the same map, but the percent of adults who are self-reporting poor mental health is much higher, right, in that inner city and areas that have the poor social vulnerability ranking and also have the poor rates of, or high problems with environmental hazards, the air pollution that I just showed you. You see similar patterns with life expectancy at birth. I showed you the detailed information for this with Indianapolis before, but you can see that it's kind of paralleled throughout the county in that lower life expectancy is seen again in the northern part of Lake County and inner city Indianapolis and a few other places throughout the state. Again, very similar patterns in the percent of adults who have had a stroke. And here this is highly relevant because cardiovascular disease, including strokes, it has been linked with environmental pollutants such as air pollution. So there is a link between areas that have higher air pollution can lead to strokes, and this is a similar pattern that we see here. And also the percentage of adults who have current asthma. Again, air pollutants are clearly linked with exacerbation of asthma and development of asthma. And again, the places that have the combination of higher air pollutants along with higher social vulnerability are the places where we see the higher rates of current asthma. All right, and so with that, I wanted to pivot to talk a little bit about the work I've been doing in northwestern Indiana. So in Lake County, in northern Lake County, one of the places where we saw a combination of high rates of pollution, high rates of social vulnerability, and high rates of disease. We've done some work in East Chicago, which is one of the areas up there. And the point of this slide is just to establish that East Chicago and the cities that neighbor it are substantially more vulnerable than other parts of Indiana. And so you can see that with the characteristics that I have here, comparing percent African-American, percent Hispanic, percent in poverty, percent without health insurance to the rates in Indiana. And you can see that all of these statistics are much higher. So East Chicago and the area in northern Lake County has a much higher minority population, much greater poverty levels, and other factors that can contribute to environmental injustice happening. So in northwestern Indiana, there has been a long history of environmental pollution. So this is one of the reasons I showed that cycle of environmental health burdens, right? So almost structural mechanisms to get these pollutants in one place and then repeatedly placed in those areas over and over time. There are 7 Superfund sites in northern Lake County compared with 40 in all of Indiana. I don't have the data here, but the other big hotspot for Superfund sites would be Indianapolis. In addition to sites that are formally declared as Superfund sites, there are 423 hazardous waste sites. And the difference between the hazardous waste sites and the Superfund sites is largely a labeling issue. And how do you want to organize and address these sites? There are underground storage tanks, which we are concerned about. Underground storage tanks often have things like oil or other hazardous contaminants, and they are notorious for leaking on occasion, and then the hazardous material can get into the ground and the surrounding areas. Currently in northwestern Indiana, there are still a lot of industries that are causing additional pollution on top of that. There's a steel mill there, there's an oil refinery, metal recycling, chemical manufacturing, coal-fired power plants. Just this morning, I saw that there's interest in having more trucking and transportation industries coming to the area. So it's an ongoing current struggle with industries wanting to come, new industries wanting to come and pollute in this area all the time, when the area has been polluted and contaminated for the past 100 years or more already. And in addition to that, we have clear documentation of the potential environmental hazards in this community. There are numerous reports of several of these industries having illegal dumping or spills or violations of EPA regulations over time. And I don't have a list together, but it would be a fairly extensive one if we were to put it all in one place. So not only are the industries there, but they're documented to not always be compliant with the current standards that we have. So this is just a little bit more about northwestern Indiana, and this is focusing a little bit more on East Chicago. So this is a picture of East Chicago from about 100 years ago, just showing that pollution in the area has been going on for quite a long time. And the picture in the middle is just a depiction of Lake County with the presence of, Lake County is in the big red box. And then we have Superfund sites and brownfield sites, which are other toxic sites marked on the map. And so you can see that I was talking about the presence of a lot of polluting entities, and they really in the area. So there are a lot of them in Lake County, and they really are centered towards the northern part of Lake County. And so just in addition to the qualitative data I showed you, here's some more documentation of that. Lake County in 2018 ranked as the 11th highest county in the US in terms of chemical releases to the environment. So across all the counties in all the US, Lake County is number 11, which is not a distinction that one wants to be proud of. So the reason I initially got interested in working in Lake County was that around 2015, there became a widely publicized issue with one particular Superfund site in Lake County, and it was the USS-led Superfund site. And these are pictures from that issue, where essentially, if you look at the picture on the left side of the screen, the part of the screen that's labeled 1 was 1, 2, and 3 were all part of the Superfund site, but the area that was labeled 1 was the hardest hit. And what happened in brief was that for most of a century, the USS lead plant, which was a lead refining plant, had operated on that site. And because it had operated for most of a century, a lot of the times there were actually no regulations or limits on emissions whatsoever. So they were emitting a lot of lead into the area. And at the time they started, they weren't even going against any regulations on that. So the USS lead plant was there for about a century. And then when the USS lead plant closed, eventually a elementary school and low-income housing complex were built either on or right near that site. And so in 2015, after having monitored the site for a long time, some reassessment of the site found that there were unacceptable levels of lead and soil in the area. So the elementary school was closed, and everyone living in that low-income housing complex was forcibly evacuated into other housing across the city. And homes that were in the other 2 zones of the Superfund site also had high levels here and there. And so remediation on those has been ongoing by the EPA to try and reduce the levels of lead in soil. So this was a big shock and scare to the communities. So not only do they have a major source of potential of lead and lead exposure in the area, but because it's been in the soil for so long, it's really been affecting them for decades before anything was done about it. So some things that we have done with the community, and I should say too that we started off really focused on this USS lead Superfund site. But as my collaborators and I got to know the area better, we realized that this isn't an isolated incident. Unfortunately, issues like this have been happening all across northern Lake County. So this is not the only Superfund site in the area. This is not the only source of contamination. So we initially started working with East Chicago directly, but we have now expanded to that whole northern Lake County area because the environmental hazards affect the whole area and not just the East Chicago area. So some things we have been doing. My colleagues and I have set up XRF days, which are days where we go to a community. So we've gone to schools, we've gone to churches and other public areas, and we've taken portable XRF equipment with us. And this portable XRF equipment can be used to get a relatively quick assessment of metals in environmental samples. So what we're able to do is take the XRF equipment up to the site, invite everyone from the community to bring in soil samples from their yard. We've also recently started doing water samples from people's homes, and we can test it for the presence of lead and other contaminants. And we've also worked with community members and community groups in the area to review things like we've reviewed some of the EPA documents that have been associated with the regulatory actions for that Superfund site that I mentioned, participation in community meetings, talking with people about health impacts. I have gone to a couple meetings to support the community when talking with EPA about what steps are being taken with the remediation and what needs to be done or what concerns they have that weren't met, things like that. Working at focus groups. And we've been trying to get some programs of science education in schools, although that has proven to be a little bit more difficult, especially with COVID happening. And we do have some pilot data from the area. So this is work that some of my students have done a lot of the work for. And this is looking at the simple question that I referred to earlier is, are Superfund site locations related to income or race within Indiana? So looking at a county by county level, just to give you the punchline here, we found significant associations of the placement of Superfund sites or brownfield sites, which are also hazardous waste sites. Both of them are strongly associated with, there are more of them if there are lower income areas, and there are more of them if the population of the county is less white or a higher minority population in the county. So the situation in Indiana is similar to what we talked about before. This is work that another student of mine has done, kind of mapping out data that the EPA had, but didn't have quite organized about lead and arsenic concentrations that were in the soil. And so this chart maps out to areas that were within the USS lead Superfund site, and the areas that are in red are not compliant with standards for the EPA. And you can see the parts in red are also exactly the parts where that low-income housing complex have been operating for decades. So literally people had been living on areas with contaminated lead and arsenic in their soil for decades. And that is a tragedy that I hope we can learn from and prevent seeing more of this in the future. All right, and then this is data that we analyzed based on collecting samples from those XRF days I mentioned earlier. And so the take-home points from this is that when we measured soil that was in the within the USS lead Superfund district, but also from parts of Northern Lake County that were all over. And when we looked at all the soil samples together, or just the ones that were in Northern Lake County, but not in the Superfund site, we found substantial elevated concentrations of arsenic in the soil, manganese in the soil, and also lead in the soil. So this documents that there was a substantial problem with metal contamination, not just in that Superfund site, but throughout the region. This is an interesting, I think this is an interesting slide from a paper we published recently about those metal concentrations in soil. So this is a box plot of the metal concentrations in soil. So arsenic concentrations are on the top, lead concentrations are in the middle, manganese concentrations are on the bottom. And so each box represents the distribution of metal concentrations from a single house. So one of the things we discovered in doing this is that there's a lot of community concern about this potential contamination. And one of the things that really proved that was when we offered these XRF days to test metals in soil, people wouldn't just bring us one sample from the house. They would bring us 10 samples from the house, and they asked us to test all of them. And so that enabled us to put together this graph. So what you can see is for many of the individual houses, each individual house, again, or each individual address, the distribution of samples is represented by one of these boxes. And here, the dotted red lines for each chart, which is a little bit hard to see, is the recommended level of that contaminant in soil. So the take-home message from this chart is that for not all of the houses, but for a substantial number of the houses, what we saw were if people brought in, 10 or even more samples, some of them would test at above the limit of concern, but some of them would test below the limit of concern. So there's a huge variability in the kind of contamination you would find depending on how many soil samples you take and exactly where in the yard you take them. And that has a lot of implications for the remediation of these sites as well. The process that was taken by the EPA to remediate these sites was that the EPA themselves went and took samples from everyone's yard. If they found a high level, they remediated that yard. If they didn't find a high level, they didn't remediate the yard. So what happened was some people's yards were remediated, but their next door neighbors' yards were not remediated at all. And these data here kind of suggest that that's not necessarily the best method to take, because depending on how many samples you take, you could miss seeing contamination in a given yard just on the basis of chance on where you're taking that soil sample from. And so longer term goals with our work in Northern Lake County and the area are to develop a full-scale community engaged or citizen science research project. We are actively seeking funding to do this work now. And we're adapting this from existing models from the University of Notre Dame and Purdue, which are both partners in the collaborators who this work wouldn't have been possible without. A longer term goal is to create an advisory group in the area. We have the start of an advisory group already, and we're adding to it. So the advisory group are representatives of citizens who live in Northern Lake County, and we will talk with them on a regular basis to share with them what we've learned and learn from them what their additional concerns are or additional questions that we can help address in the area are, so that our science will ultimately benefit other scientists, but directly benefit the community as well. And as part of the community engaged research, our goal is, when we get more funding for this, is to hire and train community members who will help recruit participants and collect their own data. We'll characterize environmental and human exposures and come up with whether or not these exposure measurements are correlated with health outcomes. And the specific exposure measurements that we're really concerned about are ones that I've already highlighted here today, with metal exposures, which we've documented are high, as well as some variations of air pollutants, which I've already shown you are elevated here as well. And we've learned an awful lot along the way, in that pollution is not the only issue in these areas. We have a lot of issues, and in some cases working with community is difficult, because what you get with often in a situation where there are environmental justice issues is that you might have some industry or contamination that's causing potential health problems, but at the same time, the industry is bringing an economic gain to the community. So there's a very complex web of issues going on, and it takes time and consideration to sort all that out. Also, we've learned that trust is difficult to gain, and everyone needs to win. A frequent interaction and communication are really critical to this. So this is why, even without the full funding to do a full-scale project, we're still working in this area constantly, going up there and interacting with the community. That we're not just there for the short term, we're there for the long term to help gain and maintain trust over time. Right. And then interdisciplinary diverse collaborations help, because everyone has different strengths, and community voices matter. That's why I'm really glad we have started that community advisory board that's helping give us guidance on what questions to ask and where to go from here. And I'm pretty much done with what I wanted to say. I just have a couple of references. If you're interested in environmental justice and public health, I would recommend these two articles as really seminal articles on getting started, and then some more background information on the USS Lit Superfund site in East Chicago if you're interested in reading more about that. As I said, I have a lot of collaborators, and I respect and thank all of them for all the work they've put into this project over time. It wouldn't have been possible without them, or with the pilot funding that I've gotten from various organizations to help spur these initiatives. And thank you very much for listening.
Thank you so much, Ellen. That was a wonderful presentation, and a great way to bring what we're learning about environmental justice to the forefront of it being here in Indiana, how it's affecting all of us around here. I'd like to go ahead and open up for questions or comments at this time. You can raise your hand if you want. You can type a message in the chat, or if you want, feel free to go ahead and unmute your mic and video and ask a question yourself.
Hi, Ellen. This is Linda. I have a question about you had a slide showing lead poisoning for children.
Yeah.
Showing that for African American, there was the poisoning of 11%, and the other one's 4%, 2.4%. So what is that new data, or where did you get that? It looks pretty high to me.
It is pretty high. That was fairly recent data, but not new. So that was data I got from, it was summarized by the American Public Health Association. So it was from a couple of years ago. So probably, but less than 10 years old for sure. And on that level of childhood lead poisoning, that's a really interesting one with a lot of change in our knowledge about lead poisoning over the years. So for those of you who weren't aware, the CDC actually recently dropped the recommended level for childhood lead poisoning. So those statistics were a little bit out of date, but at the same time, what we consider to be lead poisoning has also decreased as well. So the standard used to be 5 micrograms per deciliter was considered a elevated blood lead, but now they've dropped it to 3.5 in according to the federal CDC. Indiana's still lagging behind on what we consider a state level of poisoning, but you said the proportions are a little bit high for that, but I don't think they're really that different than what we would see now, especially if we incorporated the newer lower limit of
that was what I was going to ask. What was the level it was considered as lead poisoning? Because yes, as you said, it's recently lowered. I thought to 3 microgram per deciliter. In the past, it was 25, and then to 10, and then to 5. Now it's 3. That's what I heard. So if 3, probably, yeah, it's still there. Okay, thank you.
Yeah.
We have a question in the chat from Corey Chatterton. Could you describe the process of remediation?
Yeah, I can describe a little bit about it. I'm not an expert in remediation, but there was some pretty extensive work on that first zone in terms of removing soil and making sure that existing areas of contamination would not spread to other areas. The remediation that mostly occurred in the residential parts was removal of contaminated soil and replacement with clean soil. And that was pretty much the extent of what they did in zones 2 and 3, was just the removal and replacement of soil. And at the time, the community members were really concerned about whether the trucks coming in to do this remediation were actually kicking up dust from other areas that were spreading it around, right? So whether or not it was done carefully enough to fully reduce the spread of contamination or not. So yeah, most of the remediation was just excavation of contaminated soil and replacement with fill.
Thank you. Does anybody else have any questions or comments?
I do have a question.
Yes.
Okay, hi, my name is Lynette White, and my question is this. I noticed on your map, you have zone 1, 2, and 3. My curiosity is, in what area of Gary are those zones? Is that the northwest side, the west side, east side?
Yeah, so those zones were in East Chicago, and they were in kind of the Hammett, not the Hammett area, I forgot the exact name of the neighborhood, but they were located, I'd say, kind of in the middle of East Chicago, really. Pretty close to the major thoroughfares up there.
My other question.
Yeah, you can look it up online, or I can look up the more precise location for you in a.
Oh, that's fine. Thank you. My second question is, I noticed on you mentioned advisory groups, and that is, I appreciate you sharing that information. My question is, you mentioned a lot about the Gary region, and I didn't notice that any of your contributors were from that area. I'm curious to know if your advisory group has individuals from Gary, since they are highly impacted with your study.
Yes, absolutely. I didn't list the members of the advisory group on this, and that is 100% lacking on my part, but we do have several people on the advisory board who are from Gary. We are working with a church up there with a pastor who's very much organized and active from Gary. We're working with some other groups that we're working with a women's shelter that helps with battered women and getting new housing and placement on that. So we've got a lot of inputs from people in Gary, and some of the new issues that I would mention today, like new issues like siting of new places, new transportation facilities. That was actually from Gary, and we've recently made connections with the Brown Faces Green Spaces group up in Gary. So we're collaborating with them now as well. We welcome any additional collaborations that people might have.
We have a request for you to show the additional resources slide one more time.
Sure. There you go.
It would help if I unmute myself while I'm talking.
Mhm.
Oh, she just said thank you. So anybody else have any questions, comments? Did someone unmute themselves? In the view I'm in right now, I can't see if you have your hand raised. Let's do this. I don't see any hands raised. If nobody else has any questions, thank you so much, Ellen. We really, really appreciate everything. I know there was a lot of information, a lot of great information in helping us understand how this helps public health, or affects public health, I should say. Oh, I got another question. How are you engaging with the area medical community?
So that's a really good question. One of our newer collaborators is actually a nurse, so a nurse from Purdue Northwest, and she's working with that community center that I mentioned earlier. So I'm absolutely open to additional collaborations with organizations within the medical community up there, but we have some now and are hoping to expand on that. The more collaborations, the better, really, in my opinion.
Several comments coming in the chat. Just that was an awesome presentation. Several thank yous coming through. Great talk. We really can't thank you enough for sharing your time with us today, Ellen. We really appreciate it.
You're very welcome.